Okay, go ahead.
Okay, I guess we'll just have to wing it. I'll try to be as explicit as I can as I go through these slides. I literally created these slides on the fly today, so I'll take responsibility for them, hopefully. And in some cases, I put attribution to some of the comments so that people could correct them if they're in fact wrong. But you know, it's interesting when you're really forced to listen for the entire day. So that's what I did, except for one meeting I had to run out to where I had Doug Grano and Brian helped me out with a few notes. So you know, it's interesting. I think in this particular case, I think Yogi Berra was right. If you don't know where you're going, you might end up somewhere else. And this is not the first accountability workshop that I've gone to. And if we're going to invest in this effort, we probably should have some good idea of what it is that we want and what we want out of it. And I think today was a good step in that direction. You know, I think for a long time we've been sort of circling the light, and we've gotten a little bit closer to the light today. So I think hopefully with the follow-up meeting tomorrow, some specific things can come out of this. But I try to offer a few things, general thoughts, and maybe there are one or two kernels out of this that I can truly claim as my own, and or some value. The rest are in many ways sort of regurgitating or interpreting what in fact I heard. So getting back to what I just mentioned, asking the right question, most important to the regulatory process and one that's most likely doable. We've heard a lot of questions. We can do studies in specific areas with this change, that change, and I think in many ways when
now what happened here?
I apologize. Maybe it's
okay, that's not a problem.
Okay.
Whoops.
click down below. Sorry.
Down below what?
Hit escape.
Escape.
Click down. Oops, hit escape again.
Escape.
Click down at the bottom of the screen, the very bottom.
Very bottom.
There you go. Okay.
Okay. You know, this is in many ways been a goal of I think everyone working in this area for the last 25 years is to try to measure, does this stuff, do these regulations, do these rulemakings actually make a difference? And you know, when we look at what we're doing, in many cases we're looking for fairly small changes relative to the things that we've measured in the past. And can we actually measure these? I think Francesca's recent paper with just a couple microgram change, they saw an increase in life expectancy that I think gives us some hope that we can continue to move in this direction. But you know, we've often heard, have we sort of missed the boat, missed the opportunity to create and cooperativity in putting this together from a multidiscipline perspective, which I'll mention in a couple of moments, that I think that we haven't had to do before. And I guess the next question is, you know, there are a number of accountability studies that are out there. How many do we need? Do we need 100? Well, what was the number that John Samet finally capped for the time series? 180 studies. We don't need any more. Another time series. It's a good number. Again, it gets back to the question that we're asking and what, in fact, that we really want to get out of it. And in fact, if we do this study, we do a couple, if that makes sense, a couple penultimate studies and develop a metric for looking at this issue of air quality health outcome. Does this now become a metric in this world of OMB and measuring things? Do we now become committed to having a metric to everything that we do and apply it to everything that we do? And what is our standard of acceptability of that metric? You know, I heard some discussion in some of the early talks, you know, the usual challenges for observational studies, the issue of exposure assessment. The Achilles heel, how do we actually do that? We're obviously making some great improvements with a couple of studies that just come out. and control of the variables and various covariates. I mean, those are always going to be there, and I think we're making some progress in that regard. And in many ways, we've wanted to do accountability studies for a long time, and we've done some, but I think we're only sort of refining our tools, sharpening our knives enough to be able to do these the way we want to in the future. And I think an issue that's come out, you know, I was listening today and looking around the room. You know, I was trained as a physiologist. I've done toxicology. I've done some human studies as well as animal studies. And I look around the room and I see some biologists, physicians, a couple physicians with that kind of training, but most people are statisticians, epidemiologists, exposure people who look through the prism on from a different angle. So we see things differently. And there was a comment earlier this morning, is there a place for toxicology here? Well, probably not. Well, I'm not going to defend toxicologists since I have to defend everybody these days in my current job. But I think there is a place for a biologic perspective, and a couple points were mentioned this morning, and I'll mention those in the next slide. So it's not strictly a statistical issue that we're dealing with. We're actually looking at some basic human biology and sociology. You know, I think these natural experiments are enticing, and I couldn't think of the right word. I actually asked a couple people, but for the sake of our family discussion here, beware of fool's gold. You know, we had the Atlanta Olympic study, the Dublin study, some of these studies which looked terrific, and we ran to the bank with them. Well, now, when we look at them, they're a little bit different from what we really thought for a whole number of reasons, many of them being statistical, but things that may not be quite as simple as they see at first hand. Most studies to date have been working at a relatively high end of the dose-response curve. And you know, we can model all those things and do some fancy things. Well, you can do a lot of modeling and fancy things, and I read about them. But the dose, I can tell you from a dose-response perspective and from a health science perspective, that the dose-response curve at the low end of exposure and concentration can be very, very different from what's at the upper end. It can involve different mechanisms, and the whole response scenario can be very different. At the low end of things, at the high end of things, even in animal toxicology, you know, the big gripe with animal toxicology studies is that, well, these are really high doses. You know, what does it really mean? They're good for, you know, for hazard identification, but not much else. And then, you know, you look at slightly lower dose, and eventually you get to a dose where you're not, or an exposure where you're not seeing very much. But in fact, if you look at that dose response function from a different perspective, it may not be looking for the classic monotonic, you know, the Paracelsus, more dose, more effect, more dose, more effect, all at the curve. That early low end of the dose response curve where everyone's kind of fuzzy, whether there's a threshold or not a threshold or what's happening, and sometimes you see things, sometimes you don't, sometimes it's a factor that's contributing, maybe not. Maybe, in fact, what you're seeing is not a direct effect, but an indirect effect, much like you see with asthmatics. You take asthmatics and expose them to a high level of ozone. You measure their decrement in lung function. It's about the same as normals. But at the low end of the dose response curve, what it does is it sensitizes them to nonspecific challenges. Methacholine is often used, but pollen, other things. So when you have an ozone episode, even at relatively low levels, you still have this high incidence of asthmatic responses, because what you've done is primed those individuals so they're responsive to something else, Uncle Harry's cigar, the pollen, the dust, whatever it may be. That, in fact, there is data accumulating in the animal toxicology to show the same thing happens at very low concentrations, below the levels that we've actually exposed humans to in chamber studies, that we can measure secondary effects, both respiratory and cardiac. So it's not necessarily dose response. We do this for an hour, let's look 2 hours later. It may be tomorrow with the subsequent challenge of changes. So how do you incorporate that kind of thinking when you look into that prism from your angle versus my angle? I don't have a clue. So I think toxicology studies can serve as a test bed for evaluating some of these things. And we ought to take advantage of that if we can. And believe me, toxicologists kind of think monotonically as well in terms of the dose response. So it calls for potentially looking at things from a slightly different perspective. So some not so general thoughts. There are community and social factors. Behavioral factors, I think, were mentioned this morning. Issues of human biology, diet, personal activity, susceptibility, change in co-responsiveness, if you will, healthcare access, et cetera, changing health status, age and obesity, et cetera. Then there are human factors, individual, behavior, community. In this week's New Yorker magazine, there's an article about adaptation and climate. And they described 2 communities in Chicago that are juxtapositioned, have the same demographics, and during the big heat wave where, 300 or 400 people died in Chicago a few years ago, the mortality rate in one community was 33 per 10,000 or something like that. With a community right next to it, it was 3 per 10,000. And the difference was in the social factors, the community factors. So if we're going to be looking at things where we look at changes and intervention, and something is like a heat wave, looking at that change can have such a dramatic difference just based on human social behavior, that's something that we need to incorporate into our thinking. It's not just a statistical problem anymore. So, and then we're looking at issues, I think the issue of climate change was brought up this morning as well. We all know that the vectors are moving up into the northern hemisphere as climate changes. So that's an issue. I mean, if asthma is an issue, disease is an issue, as susceptibility factors as well. So just to touch a little bit on some of the questions, you know, this is the first question that was brought up. The panel question, how can we use existing air quality and health data? And I'm not going to go through all of these in any kind of detail. They're here, you know, I'll give them to you. But I think identifying defined actions that we could prove to be most useful in our study, the issue of microenvironmental issues was certainly important. And I think it was brought up longer-term outcomes with sufficient power are certainly things that we want to put some emphasis on. The need for better statistical methods and data focused on the most exposed, the most susceptible individuals. I think that sort of goes without saying. It's easy to say on one hand, may not be so easy to do from an analytics standpoint. The issue of remote sensing coupled with air quality models. It's the time that we start to bring these factors, these methods that we could use for doing exposure assessment together. And then keeping in mind co-benefits to public health, issue of cost-benefit, and trying to couple our research with individuals and research communities that look at many of the same individuals and same people, but from a different perspective, where we can leverage what we're doing and perhaps take advantage of their expertise, say, on the social human behavior aspect that we may not have currently available to us. Some additional factors to address, the benefits of reduced, and these were mentioned in the course of the morning, I'll just put them out here, issues of reduced medicine purchases and differences in exposure factors. I think we talked about them a little bit in the panel late in the day as well. Indoor-outdoor ratios vary considerably. And again, when we look at that, we're thinking about that in the climate change is perhaps those linear. The indoor-outdoor infiltration rate may in fact be, the rate itself may be affected by the very condition that you're looking at. So you're looking at dynamic indices. And it's often underappreciated. Certainly the issue of health care and the new health care reform may provide an opportunity for some things for us to look at. Question of retrospective versus prospective as foci for research. You know, there are still opportunities, databases available for looking at retrospective analyses. There's provides some advantage with resources and time. Prospective studies certainly give us some advantage in that we can control some of the variables to the extent that how we design this. this issue of how we get closure and clarify causality. We saw that that was a little bit of a touchy issue as we talked later today. As an experimentalist, causality to me is a black and white issue. When we get into this kind of health science, it is not a black and white issue. And prospective analyses are needed in different locations. Maybe we can compare regionally, for example, the Northeast, Southeast, Southwest, Northwest, as a way of not only looking at those differences from locations, but actually taking those environments and doing some empirical work to see if we can sort out some of those factors, by working with our brothers and sisters in the toxicology community. Interventions, looking at policy interventions as well as straight regulatory processes was brought up. The need to separate trends over time versus interventions, which are trends in and of themselves, societal factors. We're all getting older. Most of us are getting fatter. And health oftentimes goes along with those things. How are we going to sort out this factor that we're looking at, that being environment or changing the environment, with these other changing confounding elements? And then we should take advantage of rules. I think it was brought up, for example, the diesel rule or the new engine, the one that Mike mentioned was that the GDI, the new engine approach that needs to be cleaned up is not particularly clean, but gets us to go for it. Data analysis, transparency, and reproducibility. Of course, that's always going to be, there's always a snake under every rock, so we need to make sure that whatever we do is clear to everyone who has potential impact or may potentially be impacted. We need better emission data. We need better assessment of components with PM. Again, I would just sort of, from my own perspective, when you start to look at low dose versus high dose or low concentration versus high concentration responses, there can be very different interactions between components. There is a ton of toxicologic air pollution data that shows that interactions tend to be much greater at low concentrations than high concentrations where they're dominated by one component or another. So in fact, as we get down there, things may start to change in a bewildering fashion, or in fact, we may just miss that complication. The issue of looking at ultrafine particles, of course, is important. We don't have a monitoring network, but we have the beginnings, potentially, and tied with some of the NO2 near road work. And again, just so that it's a business of interactions at low concentration. Question 2, there's clearly a need. We've heard this before. That has a SIPL, and I, were beaten on quite heavily by the epidemiologists a few years ago. This whole issue of continuous monitoring, daily speciation data, looking for trends. If we're ever going to get beyond where we are, we need better monitoring data. And I think we're making progress in that regard, but still more is needed. Certainly special sites where we might want to do some work, maybe we can put some emphasis in terms of our monitoring issues, but we also need to have some really good baseline data. The issue of control data is very important as we move forward. The new generation of air monitors. We hear a lot of hoopla about individual monitors and how we do that. I think we need to be careful not to put the same standard of our thinking that it has to be perfect for us to use it. I think the Ewald-Weibel approach of do more, less well. If you have lots and lots of data, then you might be able to correct for those biases and get much better data to use in your exposures. Using archive filters is another issue that we've been talking about, but we really need to make some progress on, and I think we can get a lot done. And certainly satellites show promise in their spatial resolution and their ability to look at, to match up with the monitors. Integration of networks. Again, getting back to this where we can bring individual sampling as well as local and satellite and air quality modeling together. I think down the road, maybe not in our lives, but somewhere down the road, if we can bring those together with GPS technology, we may be able to get a much, much better assessment of exposures at particular locations. Third question, I think the issue of data, what's available. You know, the United States has some issues with privacy, more so than the European and Canadians in terms of access of this kind of data, and how we pull things in creative use of other data sets. And I think we're seeing more and more of this. We had a discussion, Tom talked about New York City in particular, and how things are changing there, and how we might be able to take advantage of some of those changing, particularly land use, the community interest. And I think there's a lot more community activity and interest in participating in some of these studies, and we really should start to mine that to some extent. I think we often look at that as the environment as sort of a passive intervention from a science intervention, that we can actually get community science and try to embrace that at the same time. Can we still learn more? Arden gave an emotional plea that we can certainly learn more and need to learn more. There are new data sets, certainly the international implications with over 3 million people still dying from air pollution. There's a lot left to do. And I think we can work, if we work from an international base, we may be able to make better progress on this than if we just try to focus specifically on the Western hemispheric side. Are we improving?
I think you meant, are we improving health for the right population?
Yes, are we improving health for the, thank you, for the right populations and getting a return on our investment? Yes, it was Brian's quote, that's why you remember what it was. And the need for data, you know, we focus, the cardiac issues sort of grew out of a focus for 4 or 5 years that we had almost entirely on respiratory. There are other issues that, from a health perspective, that we may not fully appreciate. Neurologic issues, you know, we hear those, some of the central nervous system impacts, reproductive impacts. We need to see what we can do to get that kind of information, because there may be more to measure there in terms of some of these accountability-like studies than perhaps in the sort of the grander health outcomes that we are already getting somewhat of a handle on. And getting better use of electronic data, both from an air quality and health basis, will hopefully give us some advantage. So the last discussion was on causal inference, you know, specific action and outcome. I think Corey did a good job of trying to put this in context and explain where he was coming from. I think the issue of control intervention and having that as a specific direct factor to look at from an outcome-related response, but having the appropriate control and being able to make sure that our controls are changing in the same way as with intervention as our exposure, our concern group or our intervention group, I think is really important in terms of trying to make sure that we actually are looking at the appropriate intervention impact. Say, for example, you reduce air pollution, you decrease air irritability, et cetera, so everyone starts riding bicycles and running more. Well, that may be, in fact, what's driving the health benefit as opposed to the intervention in and of itself. We need to be aware, and I'm not saying anything that people already think of, but I think it's oftentimes misinterpreted. It's just too easy to think of things as being direct, and that's where the issue of causality gets really murky when you start to look at some of these kinds of studies. The research question defined before the model. Again, that gets back to planning and making sure that we look at this in a really comprehensive and thorough way, so we don't step off the edge of the road without seeing what's on the other side. And if there's a change where we can compare the benefit to the change in impact, you know, I guess I had difficulty sort of explaining this. If we're looking at an intervention that decreases the concentration, we see a health benefit. Is there any place where we can look where there's an increase and see if, in fact, there's some kind of mirror in terms of a potency element? It might be an internal type of control for what we're looking at. You might even be able to do it in the same study. So that's something to think about. I don't know if dumbing down the curve is the same as going up the curve in terms of the response, dose response phenomenon. Just a thought. And then this whole issue of causal mediation pathways analysis. and the feasibility. Again, that's something that I can't really talk about with any kind of legitimate authority, since I work very much on an empirical side in terms of my personal experience. But I think we need to be careful on our definitions, and kind of gets to this whole issue of how we define our terms when we cross disciplines, which oftentimes can get us into a lot of trouble. So in the general discussion, I heard a few things. Causality came up again. This business of differential infiltration and other exposure factors. This whole business of the kinetics of change between indoor, outdoor, in a changing environment. We know infiltration is different on a hot day than it is a cold day, irrespective of whether you have air conditioning or anything else. So we need to consider those things. Statistical issues relevant to within and between site covariates and the ability to detect those differences. I think that was brought up. And that gets back to simply emphasizing the need for careful pre-analysis before we enter any of these discussions. And lastly was the issue brought up of technology change. We should be prepared to take advantage of those to the best way we can. So I guess it leaves us with finding a balance and ensuring our research design avoids, I think some of you, if you've ever been to the website of the annual Darwin Awards, where people remove themselves from the gene pool by doing very dumb things. We don't want to do that. And on the other hand, we want to make sure that we do things that are creative and look at things from a different angle. And when it gets to definitions, this is one of my favorite quotes from George Bernard Shaw. The single biggest problem with communication is the illusion that has taken place. We've had a lot of discussion today, and terms have been used in a number of different ways, but I think we've made some progress. So I applaud you for that, and hopefully we can go on.